Hello, hello. Good morning, everyone. It's Amanda Testa here, founder of Find Your Feminine Fire, and I am so excited for our interview today. Today, we're going to be talking with the beautiful Dagmar Khan all about pelvic floor health and why taking care of your down there is so important. So I'm going to have Dagmar introduce herself in a moment, but I just wanted to tell you a little bit about her. She is one of the leading health educators around pelvic floor, and she's a pelvic floor rehabilitation specialist. She helps women feel so much better in their own bodies, and from professional athletes to people just overwhelmed with pain and stress, just even everyday mamas like us who are struggling to get their body back post pregnancy and to be able to sneeze without peeing in our pants and all those things. But I would really excited to dive into this conversation. But Dagmar, I would love if you would tell me a little bit more about yourself and kind of what led you to this path of work.
Yeah. Well, I want to start by saying thank you so much for having me. And you have created really, really beautiful community of women who are dedicated to their health, to their well-being, to their playfulness and sensuality. And I'm really glad to be part of this conversation. So, as you have beautifully shared, I work primarily with women around pelvic floor health. And one of the things that I want to start with is that the pelvic floor area is really largely misunderstood. And oftentimes there is sort of like this view or look at the body that, maybe I have a little issue down there. Maybe I have like a scar after episiotomy, or I have a little pee-wee problem, or maybe a little bit more challenging like organ polyps, or I need to recover after hysterectomy, or all sort of issues that we're going to dive into. But really, the pelvic floor stuff doesn't necessarily just end there. The pelvic floor is, part of larger structures. And oftentimes, one of the things I have seen with a lot of my clients is who present pelvic floor dysfunction is they might have chronic hip pain, they might have chronic lower back pain, they might have breathing difficulties, they might have digestive issues. So that pelvic floor stuff doesn't end there. It really has a ripple effect on other parts of the body. And I think I really got into this work originally because of my own issues and my own struggles with trying to recover after my boy. Just FYI, I am 31 weeks pregnant right now. So there is a baby growing inside of me and putting some pressure on my pelvic floor right now, which is really interesting time. But my first boy, he's 16 now. And when I had him after, giving a birth to really, really healthy boy, I started to develop a lot of pelvic pain. I completely lost desire in sex. And getting back to exercise, getting back to aerobics and dance, which I absolutely loved before having my baby boy, was totally no question. I was leaking. I needed incontinent pads. I was once again struggling with a lot of pain. My menstrual cycles were just horrifying, so painful. So I, took on a quest on learning how to help myself be better, get back to fitness, and ultimately feel like a woman again who can be comfortable and live well in her body and is not terrified of the future and what's going to come in my 40s, 50s, and 60s. So that's really it's my own pain that brought me into this work.
Beautiful. Thank you for sharing that. I think that so many women can relate to your experience. And I know that I kind of went through a similar thing after my daughter, just feeling so disconnected from myself. And it was really a journey to feel like a woman again, like you say. Yeah. And I'd love to, if you want to dive in a little more, I know there's lots of women that don't realize how common are. And if you would, could you kind of dive into that a little bit more? Like, what are some of the most common issues that women are facing postpartum, and what we can do about that?
Yeah, I will be glad to do that. So I want to say that pelvic floor dysfunction is huge. I mean, massive. There are around the latest research is saying that there are around 80 to 90% of women that either have suffered in the past, are currently suffering, or will suffer with pelvic floor dysfunction at some stage in their lives. So it's almost like all of us at some stage, and we either figure out how to get the hell out of it, or we stay suffering. So when I say pelvic floor dysfunction, and to answer your question, like what kind of challenges new mommies are dealing with, is the incontinence piece is like a huge thing. And most women would generally understand a pelvic floor dysfunction as like, yes, I go for a run, or I'm hitting a trampoline, and I don't have that full strength and tone in my pelvic floor tissues to hold on to my bladder. The next huge one is definitely organ prolapse, and the numbers of organ prolapse in last decade are massively increasing. The latest research, I was just like looking at it, I trust last week, is every second woman after having a baby will develop some stage of organ prolapse, which is hugely alarming number. But outside of sort of the incontinence and organ prolapse, there are also other sort of issues that are kind of less defined or less understood. Things like vaginismus and vulvodynia, which it makes sex and being intimate with your husband or partner incredibly painful. And in a simple language, what these conditions are, it's incredible tightening around the vaginal opening, which of course, the smaller the entry, it's kind of common sense that intercourse will be really painful. And outside of that, also things that relate to like tailbone pain, sacroiliac joint pain. I mentioned before, a lower back pain is very interconnected with pelvic floor issues, but even things like digestion, like having chronic constipation or bloating or cramps, is very related to poor tone or lack of relaxation of pelvic floor structures.
Well, that is great info, because I didn't even realize like even digestion could be affected. But it makes sense when you explain that, and how that whole, so much is interconnected in that whole region.
Yeah, definitely. So one of the things I see with new mommies is if they had a C-section, obviously there is a scar that's developed in the abdominal area, and the scar is something that needs to be dealt with. If it's not, the scar will start to pull and tug along the abdominal organs, and will actually start to shift the resting proper position of intestines, the resting position of the womb, the resting position of the uterus, and will start to sort of create positions in the structures, in the muscles, the ligaments, the tendons, and so on, where the pelvis will begin to shift out of its alignment, which will, of course, have huge impact on the pelvic floor structures themselves. So if I may share one tool for helping with scar tissue.
Yes, please do. Yes.
Okay, awesome. So what I love to use, this is like a soft, can you see that? Yep. It's a soft inflated ball. It's super light. It's like a baby ball. They call it a gorgeous ball. It's in yoga tune-up method. You can also have like a spree ball that you can almost get in any toy shop. But what's important here is that the ball has a lot of grip. And the grip is what you're going after with the scar tissue. So you literally you put the ball on your gut, and I have video on that on YouTube, like how to specifically do it. And what you're doing is, with the ball, you're trying to create a lot of shear on the skin. So if I show it on my hand with specific movement, you're trying to do this with the ball. Okay. You're trying to grab hold of the scar and create literally a notion and stretch within the scar tissue.
Can you hold your hand up just a little higher?
Yeah.
Perfect. Yeah. Thank you.
Like this.
Okay,
That's what
gotcha.
you want to create with the ball around the scar. Of course, you need to be approved for movement. Of course, you need to be, 6 to 8 weeks after having the
Hmm.
C-section. Sometimes it's longer. Your scar needs to be fully healed. But once you have like approval for movement, this is something that you want to do. Let's say you do it today, then you have 48 hours for like adaptation of tissues, healing tissues, and then again you do it. And it's something that women can do so beautifully and like with such an incredible empowerment without necessarily someone paying someone handsomely for it, being on therapist tables, $250 a session, or most importantly, like suffering the consequences of um, the scar pulling on their abdominal organs and actually really helping themselves to realign the scar and help heal the tissue altogether.
So do you just kind of move the ball around where the scar is? Is that kind of how?
Yes, yes.
Okay.
So if the scar is sensitive, you probably don't want to go exactly on the scar, but you can put the ball to the like one side of the scar and then sort of twist your body so the ball once again creates like often my clients say it feels like a Chinese burn type of thing, but it's actually extremely relaxing and extremely like down regulating for the nervous system. It's very, very pleasant touch. And if maybe, you have a scar that has been living in your body for 5 years, it's completely, healed. It's like whole new world as compared to fresh scar. You might not have that much of sensitivity, and actually you can get the ball right on the scar and like start to create some motion and circulation literally on the scar itself.
That's so helpful. Thank you for sharing that.
Yeah.
And, speaking of scarring, do you have any tips? So what, for example, if you had an episiotomy or if you had bad tearing during the delivery, is there anything that you would recommend around that scar tissue as well?
Yeah, this is incredible question, and I get asked that all the time. So you can. It's a little bit more challenging because obviously, it's a sensitive area. So like, what do you put around your perineum? But one of the things I like to do, it's a little bit less scar specific because you have to work with a fabric. But there is like a mini yoga tuna ball. Again, it has a lot of grip. And both of these, the small ball and the bigger ball, they come from the role model method. So ladies can just like type role model balls, and they're definitely like the best tools on the market for self-care and mobilization. So you put it on your perineum. I don't recommend doing it on a bare skin. So basically, you're wearing your underwear. You put that on your perineum. Just for clarification, your perineum is a soft tissue between the holes. So you're not putting it on any sphincter. It's not on your vaginal sphincter. It's not on your anal sphincter. There's little soft tissue canister between the two sphincters, and you dock the ball there. I have worked with thousands of women at this stage, and guess what? The ball is perfect fit for like 90% of perineums in the world. So what you do when you have the ball on the perineum, you can sort of recreate same action like with the gorgeous ball. You're sitting on it. Let's say you're sitting in a chair, and then you kind of like transition your torso and your trunk around the ball. So the ball very mildly, because it's going over a fabric, again recreates this Chinese burn motion and creates like a slight mobilization of the scarring. You can also obviously do it with the hand. Like if I have a scar here and you're like willing to go in there and you trust yourself, you can create this like a subtle transition movement where you're moving in um, in the direction of the scar itself. So if the scar is going towards your left side, you are sort of maneuvering the tissue to the left. If the scar tissue is going towards the right side, you're maneuvering the tissue to the right. So you're following the pathway of the scar.
Beautiful. And I have another question about that. And I don't know if you can speak to this, but I know I have, a lot of women that talk to me about if they had, really bad tearing where it was, kind of, it's very traumatic when that happens. And, just even feeling used to, in all areas of the scar, even if it's not just your perineum. Say, for example, people that have torn like from front to back really terribly, during a delivery and they've been stitched up. Does this kind of help in all areas to try to use this technique?
It definitely can and it will, but obviously with this level of teething, that is, much more work that will be required, and
Right.
it would be, the woman would need to look at like literally everything that's happening inside of her pelvis, and probably also seek support of like trained pelvic floor therapist or like a sexual body worker who can do like hands-on work for her.
That's helpful to know because that's another thing to note is like when it's something there's so many things you can do on your own, and then when you might need some outside help from a professional,
Yeah,
an
yeah,
expert.
definitely.
Beautiful. That's really helpful tools. Thank you for sharing that. I can see how it makes sense how it would help, and just like getting that tissue moving and releasing other things that need to be
Mhm.
released from that area.
Mhm, mhm. So one of the things I have observed with my clients is when the episiotomy scar is not addressed, and let's be honest, it's not addressed in most women's bodies. This is not an information that's, freely out there, or it's like doulas and midwives are, actively supporting this idea. Um, what happens after a couple of years, the one side of the pelvic floor becomes significantly weaker, and the other side of the pelvic floor is like in a state of chronic tension. So when we look at, this common idea out there that you have a little PV problem or you have organ problems, just do Kegels and you'll be fine. Suddenly, there is this disparity where, hey, I have one side that's chronically tight, I have other side that's chronically weak. Probably just doing Kegels or pelvic floor exercises is not going to create a level of healing and integration that I desire in my body. And that is definitely more holistic, integrated approach that is required for, bringing the tissue into balance.
Right. And I think that's so interesting because that's usually pretty much the advice you're given. Do some Kegels and that's about it. And it's not really ever addressed again. So that's so
Yes.
powerful. So, and I know too, with regards to incontinence, how, what other things can you do besides Kegels that will help with these issues to kind of help, with that imbalance and the tension? Do you have anything in specific that you could recommend?
I would love that. Yes. So I've developed a really powerful training that comes from years and years of researching how pelvic floor is impacted by the core, how core is impacted by breathing, and really understanding the synchronicity between what's happening in the rib cage, what's happening in the abdominal muscles, and what's happening in the pelvic floor. And really that they are all part of one integrated system. So what I have seen, and this is really common, generally there is outside of Kegels, there is idea that woman postpartum, she needs to do Pilates in order to like get her core back and, prevent back pain and rehabilitate her midline. And Pilates is definitely wonderful, and there are incredible teachers out there. But one of the things that I have seen over and over again is women who fully rely on Pilates as like, that's the only thing, and I'm not interested in other forms of movement. They overtrain their abdominal muscles, and their pelvic floor becomes even more neglected. So it's not uncommon for Pilates ladies to have like really trained abs, but to have experience so much incontinence that is like almost alarming. So to answer your question, what needs to happen, all three structures, the breathing, and I'm talking specifically the major muscle of breathing, which is the respiratory diaphragm that lives inside of the rib cage. combined with the transverse abdominis, which is, it's like this cummerbund sheet in the midline that loop itself from the front of the gut through the side of the gut, through the back of the gut. If you see like folks who are lifting really, really heavy weights, dudes in the gym, they often wear these belts on the outside, right? And the belt is literally the representation of transverse abdominis. The transverse abdominis acts like this internal belt in the midline. And that is tied in with the pelvic floor itself, with all the muscles of the pelvic floor. So what I have developed is, I call it a trifecta for incontinence, which basically teaches women how to use the diaphragm, the transverse, and the pelvic floor at the same time, which is literally like taking a Kegel up to 112. And what happens, and the reason why this is important is that I have in my professional development, I have done also cadaver dissections. Like I've studied body really, really deeply. There is an amazing guy. His name is Gil Hadley. Have you heard about Gil Hadley?
I have not.
Yeah. Gil Hadley is someone who like dissects body in extremely compassionate way, layer by layer, so we can see and observe the relationships between different structures. So what's important for us here is that the diaphragm and the transverse, they actually live in the same plane of sheets as the pelvic floor. So if I'm bypassing certain muscle, I'm actually not going to get that full doorway in a pelvic floor strength that I could possibly get as if I'm using all the muscles together. So in the trifecta for incontinence, you're basically combining breath, abdominal stabilization, and pelvic floor lift at the same time in order to create healing integration in these structures and like really, really retrain your pelvic floor muscles to give you the type of support that means goodbye incontinence. I'm done with you.
That is fascinating. And I think that is this, and you were going to share this exercise, correct? Mm-hmm. That's okay, perfect. Yeah, I think that it's interesting. And you know, I really love, I don't know who this Gil Hadley is, but I'll ask you afterwards I can put all the information in the notes. But I looked at compassion. You know, my husband is in healthcare, so he has spent many an hour in a cadaver lab. But I think to understand fully, we are a holistic integration, right? So I love how you really are viewing this issue. It's not just localized. There's so much more to it, and you have to look at all the systems involved. And I love that. I love it so much. So thank you so much for sharing your wisdom. And I love the trifecta. So, and I would love to, you know, kind of go a little further with this. And if you wouldn't mind, could you dive into a little more? I know this exercise will help so much. I love how you say it's like a Kegels times 112, because you're really involving all the systems that need healing. And but how else you can use this, or what you can do to also help restore your vagina health and your cervix and anything else like that that might be affected by this?
So the trifecta of incontinence is specifically for treating incontinence and for creating this support structures to, help you gain full bladder control when the impact comes, when you're sneezing, when you're coughing, when you are, bouncing on trampoline. When it comes to like vaginal restoration, there are definitely other things that need to come in place. I'm a huge believer in doing the JTAC practices. I trust you girls have talked about JTAC here.
Yes, we have. Yeah. And I love the JTAC. And I would love, since you have such a background in working with this, how you may have a different, maybe unique view on the effectiveness of the JTAC.
So JTAC itself is kind of relatively newer practice to my body and me working with my clients and students. But I like to, look at really common sense, and I like to really view everything that I am bringing into my body or into my work from the physiological point of view a lot. So one of the things that really stands out for me when it comes to restoring vagina and restoring cervix after birth is that, birth happened and you had this like huge baby getting through your vaginal canal, which is really, really tiny in comparison to baby's head or the width of its shoulders or like width of his hip. It's a real thing. And hey, it's knocking on my door in 9 weeks. So I'll be definitely doing a lot of JTAC work afterwards. And what happens, because it's like purely talking from a physiological point of view, it's like a big object traveling through your tiny vaginal canal. And it's incredibly painful experience for a lot of women. It desensitizes the vaginal canal. So there are like certain nerves in the vagina itself that can go little numb. They can get desensitized. They can get disconnected from the brain, which is no wonder why women after having a baby that's like, oh, I don't feel what I used to feel. Sex doesn't feel how it used to be. I don't know what the hell is wrong with me. There's nothing wrong with you. There's nothing wrong with what you're feeling, experiencing. There are certain things that need to happen in order for you to resensitize these tissues. And outside of that, cutting off certain nerve endings, what can happen, obviously, tears, we've spoken about tear already, but micro tears can develop inside of the vaginal canal. That pressure of baby pushing through the vaginal canal can create a lot of sort of wounding, a tissue wounding, which definitely this is where that desire for vaginal restoration comes in. So using JTAC is so incredibly helpful for enhancing women's proprioception. Proprioception is body sense of itself.
I love that word.
It's how well I'm able to see in the darkness of my body. So it's very easy to sense arm, it's very easy to sense foot, but for most women sensing their vaginas, it's like, what? What did you ask them to do?
Yeah.
It's the most challenging thing in the world. Pelvis itself is incredibly hard to sense for most women, like pelvic bones, like uterus, sacrum, and so on. The vagina is like completely different world altogether. So doing the JTAC practices really helps to sensitize the opening of vagina, the vaginal walls itself, the cervix, which in a simple language is like top of the vagina, and like really bring healing, circulation, connection, nerve connection in these tissues, which is, I believe, that it's a woman's birthright to have doorway to these practices, especially after giving a birth and, welcoming baby to her world. It's really, really special.
I think that's so beautiful. And I tell you, that was such a mind-blowing experience the first time I found the JTAC. And actually that's what led me to do this work, is because it's so transformational, the difference in before and after, and how I felt in my whole, reawakening of my whole body, I felt like. But, and that, it's something that we don't learn about, and it's so powerful. So I'm so grateful that, there's more people talking about it and more people explaining how it can be so beneficial after having a baby. And I would ask you this, would you recommend to, like, kind of with the general guidelines, you kind of wait 6 to 8 weeks to start using with the JTAC, or how do you know when would be, the right time after having a baby?
I would definitely wait for the 6 to 8 weeks mark, and also, as I said, with the scar tissue, be approved for movement, be approved for ultimately you're inserting an object into your vagina, so you're looking for like being approved for penetration. But once you're good to go, it's like the world is yours, baby. The world of JTAC is yours, and it's really, really special. If I can share a personal experience,
Oh, yes, I would love that. Please.
yeah. So last year in September, I had a miscarriage, and it came absolutely out of nowhere. Me and my husband were expecting baby, and we're very, very much looking forward to welcoming our baby boy. And I was very healthy. I was experiencing incredible health, energy, everything was fine. And when I was 12 weeks pregnant, we went for a regular scan, and they basically could not detect baby's heartbeat. So the midwife shared that with me, and she said, let's not panic. Let's visit you internally as well and see if we can detect heartbeat. But unfortunately, triple scan has confirmed and approved that my baby died inside of my womb, it was horribly, horribly painful, probably because it just came out of nowhere. There were no signs, there were no symptoms. And what happened on top of that is they asked me to basically wait so the fetus passes through my system naturally, which was not happening. My fetus was living inside of me that for another 3 weeks. So I was showing up as pregnant. People were meeting me on the streets and congratulating me and so on. And I was just like this emotional mess inside of myself. So eventually I had a procedure and the fetus was removed and like a full miscarriage took place. And I knew right away that me and my husband want to try for a baby. Like we want to have a baby very, very much. But I had a lot of that the miscarriage created a lot of mistrust in me in like, things can happen again, just came so out of nowhere. And it created a lot of grief, emotional grief that I needed to process. So I was very clear on, I want to be pregnant again, but I want to get pregnant in a state of like being really emotionally healthy and, passing and moving this grief and sadness. So this is where I started to do a lot of these JTAC practices specifically to help me heal my vaginal tissues after the miscarriage was induced, but also to sort of resolve the shock in my nervous system and process a lot of this sadness and grief. And in my experience, the JTAC has been just phenomenal. I have healed beautifully in my vaginal tissues very, very fast, but also because I gave myself the doorway to crying, to processing, to being sad, to letting the JTAC be almost like a collector of some of that emotional grief that got stored around my cervix, around my vaginal walls. I was in really beautiful, like balanced place in a space of 6 to 8 weeks, kind of that postpartum period after miscarriage. I was in a really good place. And I said to my husband, I feel really ready. And if we try again, I feel that no matter what happens, I'm going to stay in a very grounded and balanced place. And lo and behold, 3 months later, I became pregnant again.
Well, that is so beautiful. Thank you so much for sharing that story. And I, first of all, want to say I'm sorry for your loss. And I appreciate you sharing your story because I know so many women experience miscarriage, and a lot of times it's not, people don't feel okay to talk about it or not sure what to say if someone experiences it, and it that you allowed yourself the time to grieve and process, because it is such a big experience to go through on so many levels, physically and emotionally. And just, I find that is fascinating that the JTAC, and it would make so much sense, but I'm so glad to hear your story of how it really helped you to just let go of all the grief and sadness and really process it in a healthy way so that you could clear that space for our new baby who's
Got a
coming
new
soon.
baby. Yeah, so there's also physiological understanding of how this works. The cervix itself, that obviously is being touched and is being sensitized and stimulated with JTAC practices, is innervated by vagus nerve, which is one of the largest nerves in the body. And the vagus is like big downregulator of the nervous system. And the vagus nerve from the cervix, it travels through the gut, but also connects to the heart. And this is where a lot of the sadness or grief to sexuality takes place. So in my own body, in my own experience, I was processing a lot of emotions, a lot of sadness, but I was also restoring the tissues in my vagina and my cervix. And all of this was and is connected through vagus nerve. So by doing the JTAC practices, I was able to how would I say that? I was able to create a right tone in the vagus nerve, which allowed me to heal physically, but also emotionally so fast.
Oh yeah, that is powerful. And thank you for that beautiful explanation of the physiological reasons behind it as well. So I just am so grateful that you are here and you're just a world of knowledge, and I appreciate all your wisdom, and thank you so much for sharing it. And I would love to just to say for anyone watching live or watching the replay, if you have any questions, please feel free to post them. And if we can't answer them now, we will definitely get back to you in the comments. And, I would love to also, Dagmar, is there anything else, any other last minute tools or things that you'd like to share?
Yeah, what's coming up for me right now is that there is definitely so much shame and so much disconnect about everything that surrounds woman's reproduction, woman's pelvis, and like any issues that can really happen in the pelvic ball. And while there is a lot of shame, and while there is a lot of disconnection, while there is a lot of suffering in silence that has really prevailed our cultures and our generations for so long, I do find myself very lucky to be doing the work that I'm doing, but also to live in, sort of a new world where there are opportunities for having these open, honest, intimate conversations, where we as women have doorway to better understanding ourselves, where we as women have this starting to have these support system like you have created inside of this amazing Facebook group, where we can talk to each other, we can listen to each other, we can support each other, and really this collective empowerment that comes from making better choices, understanding better, but also sort of dropping the layers of shame just by speaking up about it, is allowing us to create this new paradigm in the way how we live inside of our bodies, how we connect to our bodies, but also as a mothers, what we really share with our next generation. I have been brought up with incredible body shame from my grandmother's side, from my mother's side. And even though I don't have a daughter, and I'm not expecting a daughter, really my intention for my next generation is to help them tap into the beauty that comes from loving and honoring your female self, loving and honoring your female sexuality, and everything that surrounds this sexual place of well-being. After all, one of the big reason I'm obsessed with working with pelvis is pelvis is a place from all through all of us came from. It's the doorway of our species, is a doorway of our humanity. And by us treating our pelvises with love, with curiosity, with sensitivity, with presence, we have a doorway of creating a whole new world.
Oh, I love that. That is absolutely gorgeous. Thank you for your help in that. And you are doing such amazing things in the world. So please, will you share with everyone where we can find you?
Sure. So my website is dagmarkhan.com, is DagmarKhan.com. You can find me on social media, Dagmar Khan on Facebook, Dagmar Khan on Instagram. And then I would love to share the free training, the access to Trifecta of Incontinence. It's once again about retraining the breathing, the core, and the pelvic floor all together at the same time. And yes, you have the link there, bit.ly/incontinence trifecta.
And I will also put all these in the notes so everyone can access where to find Dagmar and to download this amazing free training that she is giving us, which is such a beautiful gift. Thank you so much.
My pleasure. Well, thank you so much for having me, and thank you so much for creating this opportunity for all of us to talk about our womanness and humanity.
Thank you. And thank you so much for being here. It's been such a pleasure and an honor to talk with you. And thank you so much for everyone watching. And again, if you have questions, please feel free to send them our way. And we'll have a wonderful day, and we will see you next week. Thank you so much.